Minutes late. Welcome to the telemedicine presentation. Our speaker this morning is Dr. Aaron Smiley here, and he is a 2007 graduate of U of I. He has practiced in an equine practice. He has practiced in a very large mixed animal practice, and now he is chief of police.
Yes.
Something at two practices, one in Anderson and one here in Indy, over in the fancy Geist area. Is that
only the finest?
Only the finest. Which this will come out today. If there are seat belts on your chairs, you better put it on now. This guy's high energy, and I'm telling you, it's going to be interesting. I'm not done yet.
Oh, okay.
Just stay seated there.
I forgot to put my seatbelt on.
Just I know, put it back, put it on. Okay, let me see, where was I? Okay, in addition to his practices, he is also the chief of staff of advisors, I guess, for 8 vet corps practices in Indiana and in Ohio. Is that right?
That's right.
All right. Aaron was the treasurer for the IVMA board of directors. He was relieved of that position and placed in the vice president position, who, of course, as we all know, does nothing. And so no damage to be done there. So that's where we have him right now. And I'm honored to be on that board with you, experiencing you more often than I'd like. Aaron lives in Noblesville with your wife, Kristen.
Yes.
And 4 daughters. I believe that probably explains a lot, but that remains to be seen. And without further ado, Dr. Smiley.
Thank you, sir. All right. So I'm not gonna wear the microphone because I think I'll be obnoxious if I do. Okay. What we're going to do is we're going to talk about telemedicine. This is a picture that I took when I was up in north central Indiana, Elkhart. I love the clouds. I always pretend like I live in the mountains. So I took a picture of the clouds because I'm like, oh, maybe I live in Colorado, but I really don't. But that's some farm in Elkhart, Indiana. I'm going to present today with Dr. Sandeep Pulim, who's going to bring us an interesting perspective from the physician side. He works with Medici, and we'll show you as far as this. He's going to demonstrate this specific app. So you guys can use that. There are different apps out there. So this is not a Medici exclusive thing. It's sponsored by Medici, but we'll show you. It's an app that I use. I like a lot. So we'll show you how to use that, and you might fall in love with it. Okay? But very, very interesting perspective. We're honored to have him here today to get the human side perspective. They always feel like they're a little bit in front. Like Jerry was saying, I work for Vet Corps. They've got 250 clinics across, mainly on the East Coast, Chicagoland, and then a few in Indiana, but they're a consolidator. If you ever interact with them, they're nice people. They say what they mean, and they're all about local control. And so managing a couple practices for them, just so you guys know they're good people. Like Jerry was saying, IVMA board, and then I want specifically on the telemedicine task force. So that's, I suppose, what gives me the authority a little bit of authority to speak on the subject. IVMA is looking into this issue for you as a member. Just one of the things that IVMA does. The pets that we have, Gus the cat, Bon because all of our pets need 2 names, I don't know why. And then Elfie the little Westie. But the cat's the best cat. My 4th daughter loves, and she'll ride the dog and then strangle the cat, and they both put up with it. There's my 4 daughters. Yeah, too much fun, right? I'm more lucky than I deserve. So, and my wife is very nice, and she's the glue that holds everything together, because most of the time I'm not. So, what we're going to do today, so brief outline, history of telemedicine. A lot of this is going to be intuitive. You guys can probably do a better job describing that than I can. Definition of what telemedicine is. Big question, what's legal? What's legal in the state of Indiana? What's legal as far as you practice in other states? I won't address that. We'll talk about Indiana specifically. And then how to practice better telemedicine. Because the reality is, as we go through the history, we're all doing telemedicine, but we can do it a whole lot better. A whole lot better. Okay? And you guys might be doing it better already. And then Sandeep and I are going to do a specific demonstration for Medici, so you can decide whether or not that's something you want to integrate into your practice. So going as far as preparing for the talk, I went back. This is the James Harry book that my maternal grandmother gave me when I was 10. We've all read it. And it's so much fun, and I decided to go back and read it in preparation for the talk to see if James Harriet ever did telemedicine. And sure enough, he did, right? Most of the stories are him going out to the farm, but early on in the book, there's a farmer with mastitis. James doesn't want to go out to the call, so he advises the owner. He diagnoses, hey, old cow's got mastitis, right? Farmer says, oh, there's flakes in the milk or whatever. He says, oh, the old cow's got mastitis. This is what I want you to do until I come out tomorrow, right? James Harriet is practicing telemedicine. So now we're talking the 30s, right? Because that's when he's writing, pre-World War II. James Harriet's practicing telemedicine. This is not new at all. In my specific career, so the 10 years that I've been out of school, telemedicine used to look like the colic call that you'd get at 4:30, right? So the owner goes, oh, the horse didn't really eat a good breakfast. Horse hasn't been feeling good all day. What should we do? It's getting to the end of the hours, right? And what I would do over the phone is diagnose colic. Oh, sounds like your horse has colic. Have you given the horse Banamine? Have you walked the horse? Yes, no, and then that would determine whether or not I was going to go out right then or wait till 8 p.m. and get upset and go out. All right? I mean, but that's how I practiced telemedicine when I was first out. How I practice telemedicine now is this. It's text messages all the time. Right? So this is my sister-in-law. She's got a dog. She lives in the same subdivision. She doesn't come over. She doesn't give a call. What does she do? She sends me a text. Oh, she says she's mildly dramatic. God loves her. I love her too. Mildly. I'm having a very bad day and now this. Woe is me. I need your advice. Bailey, so B, ate and vomited a part of it, but not all the hard plastic pirate coin. I found one tiny piece and it's sharp. Then the dog vomit spots with some chewed up in it, but I can't be sure all of it's there. She never does this. What do I need to watch for? All right, so my sister-in-law is worried about her dog. Her dog ate something it shouldn't have. She wants an expert opinion. She has access to a veterinarian because I'm her brother-in-law, and she shoots me a text. I practice telemedicine. I've seen Bailey the dog, and I say, oh, I'm so sorry, right, because your life is difficult. Watch for more vomit. Let me know if she keeps throwing up. She says, okay, thank you. I never get another text. Dog did fine. Dog had a mild upset stomach, no big deal. Everybody in the room would be like, you're fine. All right? I just practiced in telemedicine. I diagnosed gastritis, and I didn't tell her that. I told her, I gave her a medical opinion, you're fine, and I told her what to do next. What's your action? If that dog vomits again, I want to know about it. It's telemedicine. Okay? All right. So just so we're all, is everybody comfortable? Is everybody doing that on a daily basis? Yeah, okay, I'm doing it all the time. All right, specifically, what is telemedicine? And the IVMA did a really nice job, and they were pretty time sensitive on this, which is surprising editorial comment for the IVMA. Usually it's but they actually came out with something on time, which I was appreciative. They have, this is an IVMA graphic, all right? All the different things that we talk about when we talk about telemedicine, right? So we're talking about specialists. So I'm going to send the ECG, and that's been going on for a very long time. Since the 80s-ish, right, that you could send an ECG off to be read. So that's been going on for a long time with no concern at all. Poison control is up there, so you call, over in Urbana, you call poison control. Poison control practices telemedicine. Now what they would do is they would call that triage telemedicine, but they're still practicing telemedicine. That's been going on for a very long time, no conversation. What all of a sudden started a conversation in veterinary medicine is right here. So this, where I'm communicating directly with the client, and the conversation in veterinary medicine now is what constitutes a VCPR. So that's the big conversation. We're not going to spend a whole lot of time on that. That's something that the IVMA is working through as far as with the task force, how we want to define that in the state of Indiana in concert with the IVMA and all those kind of things. But for our talk, when Sandeep and I present, we're specifically talking about you interacting with a client that you have an established VCPR. That's what we're going to call telemedicine. So what's legal? Now in your handout, Lisa made handouts out for everyone, and they're really good handouts. And what you have on there is counsel, so legal counsel giving an opinion specifically for the state of Indiana. All right? Again, your IVMA dollar's hard at work. Right? That's what you're paying your dues for, is for counsel to review. And what we found is, let me go Indiana first because I'm on a roll, and then I'll come back to IVMA. Okay, so in Indiana, if you read that there, I think it's on page 2, where it specifically lists out the Practice Act, our Practice Act in the state of Indiana. And the word that's under interpretation that we don't know yet is the animal's been seen. Now, is that seen via my screen? Or does that mean seen as far as I put my hands on Fluffy? So counsel says the most conservative interpretation is that you've put your hands on Fluffy, right? Or Trigger. You've touched Trigger. You've been there in person. But it's open for interpretation. When they did the Practice Act, I don't know how long ago this Practice Act, do you remember when we did this Practice Act? 10, 15 years? What?
2008.
Okay, so in 2008, this wasn't on the radar screen when we were putting this together. Nobody was thinking, do we need to define what seen is? So that's why it's up for interpretation. Counsel says the most conservative thing to do is to consider that still that you're touching them, but how it would get defined under the current Practice Act is somebody would have to come in front of the Board of Examiners. So somebody's got to go first and say, hey, I'm doing this, is this legal? Veterinarians on a whole are a very conservative group. That's probably not going to happen, but if you want to be the first one, feel free. You know, we'll line you up and you can go get an interpretation, and that's how we would get it. Now the other thing that we can do is we can adjust the Practice Act if we choose to do that. So as a body of IVMA, that'll be conversations that we'll be having. So if you have a strong opinion, make sure you're talking to the Board of Governors, make sure that you're talking to the people on IVMA board. Right now there's a telemedicine task force, all right? AVMA policy, so the AVMA creates a model practice act. They don't control how we practice in the state of Indiana. What gives us license to practice is the governor's office and the General Assembly. That's what gives us the ability to practice in the state of Indiana. But AVMA creates a template. All right? AVMA says a physical exam is something where you're touching Fluffy or Trigger. AVMA says you cannot establish a VCPR electronically. You go over to the state of Illinois, they have specific language in their Practice Act that says it has to be an in-person. Indiana, we don't have it. Texas, right? Texas, they had a lawsuit. Texas says you got to touch Fluffy or Trigger. Okay, but in Indiana, it's a little bit up for interpretation. Just so you understand. Okay, so that's what is legal. All right, I'm going to invite up Dr. Sandeep Pulim. He is with Medici, and I had the pleasure of hanging out with him. He and I have been on the phone, I don't know, the last 6 months, talking back and forth. He's the Chief Innovative Officer for Medici, and that innovation is appropriate as far as in the title. Right? So he and I, just in a couple hours that we were having a conversation, he gave me multiple things to think about as far as I drove away. I'm like, that's a really good idea. So, and then as far as his perspective from the human side is very, very good because of the resources that they have on the human side. So we're honored to be able to have him here with us to give us the human side of telemedicine.
But I'll try to project my voice as loud as I can. So thank you, Dr. Smiley, for the introduction. Just as full disclosure, I'm an employee of Medici, just so that you guys are aware of that. But you know, the reason I joined Medici, so I'm just a quick summary of how I got here. Trained as a medical doctor, ended up, due to family circumstances, taking a different career path than my friends. Been involved in digital health now for over 10 years. Had 3 startups prior to joining Medici, so we built a lot of care transition protocols, built a company for telemonitoring for CHF patients, transitioned to an artificial intelligence company to do CME-based learning for real-time CME based on patient needs and gaps in knowledge. And I joined Medici because I started to see the trends in where healthcare was starting to be delivered wherever patients were demanding access to care. And that's really where Medici is focused on. So we're patient-centric in the sense that we want to help you manage your family's health as well as your pet. That wasn't something we were kind of aiming for. It's just something that patients were kind of, hey, if I can talk to my doctor, why can't I talk to my veterinarian? So we're the only app out there that allows you to have a relationship for everything that you need to manage the health and wellness for a family. So that's important too. So because we started as a patient-centric place, everything I'm about to tell you is going to make sense. So what I'm going to talk to you today is about a case study from Dr. Scott, who's a pediatrician in South Miami. So she's actually the medical director of a community clinic that serves underserved children. And you'll hear her own words describing this, but the biggest challenge that they were facing was a lot of these families couldn't come in and see her, and so they were kind of going to the ER for their primary care needs. And as you know, that's the most expensive kind of care that you can get access to. So part of the challenge that she was trying to solve was how do we improve access to these pediatric patients, avoid ER diversion, and actually create ER diversion, and add efficiencies into our practice. And ultimately, similar to Dr. Smiley, who found us, she found us. So she actually did a lot of research. She tried to learn what telemedicine was about. She joined one of these large organizations that you hear about, kind of like doctor on call, like basically on call doctors that you call to get remote care services from. She learned two things. One, she didn't like the experience because she was getting calls from patients she didn't know, but she also saw that patients were willing to talk to someone remotely. So she wanted to combine those two. She wanted to do that, but with her own patients. So she did a lot of research and discovered Medici on her own and started to put it into practice. And the reason I talked to her was our back-end analytics started to see this huge list of consults coming from South Miami. Like, what's going on in Miami? So I called her up and I said, hey, can we come see you? So this is what she was doing. By implementing Medici in her practice, the cool thing with Medici is just like Dr. Smiley was able to message with his sister-in-law, wouldn't it be cool if you could have that with your own relationship with any doctor that you're taking care from? Obviously, they're not going to give you their private number, but that's essentially what they were looking for, right? Everybody should have a Dr. Smiley that they can talk to, even though you're not his sister-in-law, right? It's the same thing. That's what this enabled her to do. So everybody's comfortable exchanging messages, but we have to make it secure, HIPAA compliant, all the regulatory requirements that make it feasible so that you can practice in your regulatory environment. So that's what we built. So everything starts out as a secure text message. So your patients can't call you, can't video FaceTime with you. You manage what that interaction looks like based on the clinical need. So when you get that text message from a patient, you can quickly escalate that to an audio or video call, or say, hey, you know what, I'm with the patient, I'll get back to you in 10 minutes. So the patient's not sitting worrying about, is it going to get back to me? Do I need to go to the ER? So it gives you a lot of flexibility in adding this to your practice. So we did a study with her for 4 months to see how she was incorporating it. So it's kind of small to read, but what you're seeing here is that distribution of consults. So all these dots are Medici consults that Dr. Scott did. And what you're looking at here is, this is 9 a.m. in the morning, and that's 11 p.m. at night. So the biggest question we always get is, hey, is this going to disrupt my workflow? Am I going to be able to manage this? So the question I ask is, do you ignore a text message from friends and family during your day? So my wife's a neonatologist, right? So our kids and I are texting her all day when she's in the NICU. She responds, obviously it's not going to be 2 minutes or 30 seconds after I send the message. But because it's a text message and not a phone call, you don't have to step away from the patient. You can just glance at your phone between walking to the next patient room, take a quick message back. So that was actually really astounding to see that it's not after 5 p.m. It's actually during the workday that she's able to handle all these messages. And the most stunning thing after that was, because these are her known patients, these are not random patients finding her on Google, right? These are her own patients that she introduced this to in her practice. So after she's wrapping up, they're about to leave, she's like, hey, I'm going to invite you to use this new thing with me so that if you have questions, just contact me. You don't have to worry about, do I need to go to the ER? And having that in place, effectively, as a mom or a dad at home taking care of kids, just having that option lowered anxiety, lowered that need to go to the ER. And you'll see her talking about this. So that was the really powerful thing. And when we analyzed the results of what she was able to do, 52% of the consults that were clinical in nature she was able to handle because they were her patients, she knew them, without even having to escalate that to an audio or video call, just by texting back and forth. And we'll show you how it works. But that's astounding, right? So if you think about it, in a day-to-day, 30 to 40% of your in-office visits as a doctor are not necessary because you could have handled that remotely. Which means, instead of having a 3-week wait time to come see me for the patients that I need to see, they can't. With Medici, it allowed her to open up those slots, shift that load to this. So now when patients need to see her, she's like, yeah, you don't have to wait 3 weeks, I have open slots now. So that's really what improved that efficiency in her practice. And she was also, because she was able to escalate these text messages to the video component when needed to, she was actually able to do, in some cases, do remote assessments of potential triggers for asthma for her patients that she couldn't see before, right? So she could always kind of ask, but when the mom was saying, hey, my daughter looks like she's in distress, she was like, great, let me see what's going on. And she could get a kind of like an environmental analysis now that she never had access to, and actually resulted in preventing 2 ER visits where the mom's like, I think my baby's not breathing right, so let me see, calm the mom down, told her what to do to get the baby calm. And there's another example of colic as well. Mm-hmm. So this young mom was like, baby's been crying for nonstop, I couldn't get her to stop her chores, so she's like, let me see what's going on. And then kind of told the mom, hey, look, I'm on Medici, if you think you need to go, contact me anytime over the weekend. She never heard from her. This is a Friday afternoon. By Monday morning, everything was settled. So that was literally 2 examples of what happened over this course of time. But ultimately, this resulted in improved patient satisfaction, expanding access to care without adding another employee, without having to deploy more resources that patients may not be able to engage with as efficiently. And ultimately improved outcomes, right? So now you have a patient that may not have access to the care they needed, would end up going to the ER, because they now have this means of communication. So ultimately, Medici is about reestablishing that doctor-patient relationship that always existed, right? So instead of doctors coming to your home like they used to, and that's a great example of what you said, telemedicine isn't new.
No.
Like, so, in ICUs, it's been happening for 30 years, right? Where it's going now is that consumers have experienced how on-demand works, right? If I can order a car and can get where I need to go, if I can, do my banking on my phone, why can't I talk to my doctor? And the cool thing is, it's your doctor, right? That's the thing that separates Medici from everybody else out there is, this isn't some random person. You have to establish that relationship. And once, it's not like if someone finds you and happens to want to talk to you, you have the choice to accept that person. So that's what's unique about Medici. It's not where people that you don't know are asking for care. It's meant for established doctor-patient relationships. So this is Dr. Scott in her own words. So let me see if you guys can hear this.
My name is Dr. Tina Carol Scott. I'm a general pediatrician. I've been in practice for the last 23 years, and I'm the medical director of the South Miami Children's Clinic. We've been open since 2007, so this is a little over 10 years now. And
How many here know your portal password for your doctor?
Oh, for my physician? Yeah.
And how many doctors do you have?
2.
You know both of them?
Nope.
Okay. So Medici becomes that hub, right? So you don't have to now, oh, what's Dr. Smiley's portal password? What's my, what wife's OB-GYN? What's my mom or dad's neurologist? So Medici now becomes the hub for all of your communication needs. And part of the problem with these portals introduced on the people side of medicine is doctors were kind of forced to make these interactions into an EMR system that was meant to be a billing, right? You code everything and you get paid. It wasn't meant to handle communications. It wasn't meant to, do care delivery. And that's where kind of things were being kind of crunched into. And the problem was, first of all, doctors were like, hey, you can email me, but I may not get back to you within 72 hours. That's the standard for responding to portal messages in doctors' practices. And also, you don't get paid for responding to emails, right? So that's the challenge that Medici solves is, I'm happy to take these messages because I know I can get paid for those consults. So the way the pricing works here is every doctor gets to set their own Medici fee. So it's usually, we recommend it to be around what the patient would expect to pay for in-office copay. And you determine based on your geographic, demographic, patient, what their needs are. So in New York, doctors could charge $40 or $60 because, I pay $50 in parking if they're gonna come see you. But in Texas, some doctors are, whatever the copay is what we recommend. And then it's really cool to see how doctors are kind of implementing this and getting a sense of, and patients, from the patient's perspective, if I'm gonna take a risk and call one of these call box doctors, pay $40 to talk to somebody that I don't know who can treat me for 5 or 6 limited conditions, I'm willing to pay that to my own doctor, and that's really what's happening. So thank you.
Very good. Okay, so interesting perspective, and in the sense of pediatrics, right? I always think pediatrics probably has the closest representation of what we're doing. So fascinating as far as how she's using. All right, now we're going to move into better telemedicine. All right, this is, so my sister-in-law, my conversation, super short, not painless, good to go. This was a more painful conversation. So this is somebody that has my personal number because I'm a veterinarian, I'm a bleeding heart, and I give out my personal number, and that's ridiculous, but I do it. Okay, so here we go. January 4th, 7:22 a.m., trying to get a lot of kids on the bus, not the most convenient time. When somebody sends me a text, the expectation is you're going to text back pretty quickly. I mean, that's just kind of the common social norm. All right, so let's follow this. The lady says, who has my note, hey, not sure why, but Razor had diarrhea starting at noon yesterday. Right before we went to bed, he threw a bile. Last time we had diarrhea was around 2 a.m. We didn't feed him last night. Should I feed him this morning? He's going crazy. Correction, he had diarrhea last night at 12:30, so it's been about 7 hours. Lady's distressed, dog has diarrhea. Could it be something bad? Could be. Could be. So now I'm a veterinarian. My responsibility, if I engage in this, is I have responsibility to this pet and this owner to be able to make, I can't blow it off. So I just gave her my personal number, now I'm on the hook. Professionally, I'm on the hook. Oh, just ignore it, Aaron. We don't do that. We don't do that, okay? So then so I say thumbs up, and that's my way of saying, give me some seconds, okay? So then we go through, so normally give him, so then she keeps going. So I give her the blow off thumbs up like, hey, give me some time. She keeps giving me information. Then she says, oh, you're going to laugh at me, but I went to Google and my dog's about ready to die. Now, good for her that she's consulting with a professional, because when she goes to Google, she's going to get a lot of information. She still has to know how to sort it. And she doesn't know how to sort it because she's not a trained professional. A lot of information, a lot of good information, just don't know how to triage that information, right? I don't know how to triage my kids' information. I can make a fighting chance, but unless I'm a pediatrician, I don't know, okay? So then I tell her, yeah, you're right, I'm laughing. So I don't respond because I'm so irritated. What does that do as far as if I don't respond to regular clients, they get a little bit miffed, like, hey, where are you at? So now we get to 9:30 in the morning. No diarrhea yesterday, so it's the next day. He hasn't pooped though. Oh well, thank you. Okay? So I kind of blow this one off, but it's not a really good client building. Okay? So now we get to January 6th. She comes at me again. Diarrhea started back up. I say, okay, let's put him on a prescription diet. All right, fine. I tell him because I'm a bleeding heart, I'll drop it off at your house. Okay, great. Right? That's me. Okay. So then she complains about the cost. Right? Oh, heavens to Betsy. Because of course, when she sends me a text message, how much does that cost her? Zero. Is she in a mindset to spend money? No. If she's using Medici, she punches, she's ready to spend money. Not angry about it. She's just in a completely different mindset. And that's what's so beautiful about the system, especially for our clients. It takes, well, texting is free, to, oh, that's a professional, and I'm going to pay a professional consulting fee. I'm ready to spend money. She doesn't even want to spend money for the prescription diet.
Question.
Yes, sir.
Does she know that going in?
She knows it going in. She has to put her credit card in. She knows it going in. Everything's eyes wide open. Good question. No bait and switch on this one. Everybody knows. Yep.
What happens if she circumvents Medici and texts your number, which she still has? You're going to tell her to go through Medici?
So I did it. And I had to put on my big boy pants. So I told this lady,
I'm not seeing you doing that.
I know. Okay, so, and this is the straw that broke the camel's back. Now it's July 4th. It's a holiday and we're doing this nonsense. It's a holiday. Come on, lady. Come on, lady. So what I said to her, and she's a family friend, of course, I said, hey, and what my excuse is for accurate medical records, we need to get this moved over to Medici. And she kind of blew me off. She's like, oh, but let's do this. No, for your dog, for medical records, I need to move you on to Medici. Here's an invite. Oh, so you're saying, and I don't have this covered, you're saying you don't want me to text you? I'm saying I want you to use Medici for veterinary questions so we can keep accurate medical records. Now that was enough excuse for her where she didn't think I was just being a bad guy. But that's my line, to get them onto Medici. And I've made that transition multiple times for people that have my number, like, I'm not doing this anymore. Hey, for accurate medical records, I'm going to get you onto Medici. Because of course, does this make it into my medical record? No. That's nowhere to be found. Slightly illegal, right? Don't tell the governor, but that's slightly illegal because I'm diagnosing things, I'm prescribing things, and it's nowhere to be found in her chart. Okay? So then she goes on July 4th, the dog starts puking again, she's for sure it's going to die. Now, okay, it's July 4th, she sends me this text message, does the dog have GDV? I don't know, it could. It could. So she goes out, she says the dog exercises and now the dog's trying to die. So if I sit and blow her off on a GDV, what do I have? A dead dog. I still have a responsibility because I've entertained this. It's not good. So now my stress level is going through the roof because I know I'm going to entertain this lady. Okay? So now I interact with her. Okay? And I give her the thinking face. She keeps texting. Okay? And then that's the end of it. Alright? So just to say, and this, I don't know if this resonates with anybody as far as those kind of bad, that telemedicine is irritating to me. And it's not good medicine because it never makes it to the EFR. It's just not good. And it's not good as far as for client support either. I don't want to have an interaction with my clients and be irritated. That's not good. It's not good. Okay, so how do I currently use Medici, telemedicine, specifically Medici? Okay, surgery follow-ups. I bill it into the surgery. You come in for a spay, cut the dog open, sew the dog up. Hey, great news, we buried all the sutures. We're going to do a recheck of the incision in 7 days, and you're going to use this app, and it's going to cost you $25, I don't know, $25. It's just part of, so, anesthesia, spay, Medici consult, 25 bucks. Okay? Now, it's on them, so I bill it out right then. I have the option of Medici to charge them or not charge them. So don't tell Medici, but they don't get any money from that consult. So then my owner, if my owner chooses to do it, takes a picture at 7 days, sends me a consult. Hey doctor, this is Cece's incision, what do you think? What, 9 times out of 10, what am I saying? Looks great, good surgeon. Incision looks great, 2 thumbs up, thanks so much for sending me a consult. The owner's pleased because they don't have to bring the dog in for a recheck. Those are frustrating for the owners. Even if I don't charge them, they come in for a recheck, I really only have to look at that thing for 2 seconds. And we all know it, but if we go in that room and we look for 2 seconds and leave, what is the owner's perception?
Don't charge.
Wasting. Even if I don't charge him, wasting my time. I'm getting out and doing this and getting a daggum dog in the car, and all he's got time for is 2 seconds. And it's a negative for both. That's not good customer service. They so much prefer this, right? So it's just built in. I charge it, Medici doesn't make a nickel. So it's just part of, that's how we primarily use it right now. Surgery follow-ups get a line item for a Medici recheck. Sick recheck. All right? So I've got a dog that has, this happened this week. So the dog comes in and she didn't know about Medici. She goes to the emergency clinic, blood from the mouth. They say, really bad oral disease, you need to get a recheck from your primary. I say, okay, so she calls me up, she says, hey, blood from the mouth, can you come out to the house? We do house calls. So can you come out to that? Sure, love to come out to the house. Go out and look at the dog. Sure enough, crusted blood around the mouth. Because anybody said, they say that there's blood from the mouth, it's like, yeah, one drip. Like, this isn't real. It was real. And so crusting blood around, a little bit of blood on the tongue. But the dog is just all sorts of crepitus behind. And she says, this mouth is keeping the dog up. The dog won't go to sleep at night. It's so painful from this mouth. I go, I don't know, I see a lot of rotten mouths. They usually aren't that painful. Well, the dog has just got crippling arthritis, right? So it puts all sorts of weight in the front. The dog is so painful from the back end, not from the mouth. All right, so I say, hey, talk to me through Medici, because her primary concern is that she can't sleep at night. All right, so here's some meloxicam, here's some tramadol. You're already on something for some antibiotic, Clavamox as far as for the mouth. Okay, so then she sends me a Medici message at 7 o'clock at night. Hey, dog can't get to sleep. I need to go to work tomorrow. What can I do? Oh, load it up on tramadol. How much tramadol have you given? Oh, this much. Oh, heavens, drowned it in tramadol, right? Let's kick a little bit more meloxicam in the dog. I can get away with it, right? Once, I might get some diarrhea, but okay, if a dog really won't get rest, and I watch the dog, is pretty arthritic, so now she's talking to a veterinarian that knows that dog, that saw that dog, and she can get medical advice at 7 o'clock at night. Loves it. She and I continue to consult as far as on Medici, like I sent her this morning. I messaged her, she chooses to euthanize the dog, and she told me, she's like, thank you so much for sticking with me through this whole thing. Right? So now, my customer support is through the roof. I'm not frustrated because I'm getting paid for consults. Her satisfaction is high because she knows, just like the babies that are colicking, she can get a medical opinion from a veterinarian about how to get through the night with her dog. Okay, so those are sick rechecks. We do a lot of those. Those are billed through Medici. I commonly don't bill people at the time, but sometimes I will. I say, hey, I want to if it's a recheck, I'm trying to do it through Medici. Okay, but for her, I'm hitting pay for consult. So when she and I get done, and Sandeep and I will show you how to do that, boom, and she's dropping 25 bucks through her credit card.
Is that per text or per condition?
Good question. I tend to do it per case. It's totally up to the veterinarian. So you can hit that button as often as you want. Now, being a veterinarian, that button always makes me nervous. I sweat a little bit, and then I pace. Oh boy, should I hit the button? I'm like, no. She put her credit card in. She's ready to pay this. I'm a professional. Hit the button, Smiley. But typically, like with this dog, she only got knocked one time. Right? So this condition, I'm going to say you're going to pay a $25 consult for this. Okay? And it was probably, I don't know, 4 or 5 texts. But like Dr. Pulim was saying, a text is so much less invasive versus a phone call, right? Returning phone calls is one of my least favorite jobs. Oh, here we go, returning phone calls. Okay, chronic condition, great for glucose curves. So on the small animal side, glucose curves. Hey, go through Medici. You're going to take your glucometer home. So if they send emails, guess how much I get paid to interpret a glucose curve? Goose egg. I still have to pay attention. I still have to know what's going on. And the email doesn't get returned near as often. Because I don't go into my email but 2 or 3 times a day because I've got to sort through emails, not where I'm going to sit like my device. So if you send an app, or if you send a message through Medici, I'll get back to you. Here's my glucose curve, what should I do? Here we go. So we do it a lot for chronic conditions like glucose curves. Then the other one's after hours. Clients love it, veterinarians hate it. With Medici, you get the choice. I can turn it on and off at my leisure. So what I tell my clients is, hey, if you get something after hours, check it out. If the green dot's there and it's 2 in the morning, shoot me a text. I'll wake up and I'll respond to you. If the green dot's not there, I'm not there. So the onus is on me how available I want to be. Right now, the practice that we have in Indianapolis, I'm trying to grow that thing. So how often do I turn my green button off? Never. If it's 2 in the morning, I'll answer you. That's Aaron Smiley. You don't have to do that. That's Aaron Smiley who wants to grow a practice. You guys that have established practice, that you're making money hand over fist, you turn that sucker off whenever you want. Right? But for this little guy who's trying to get something done, I leave the green button on. All right? So that's currently how we're doing telemedicine.
Multi-doctor practice, is it one doctor, every doctor answering it, whoever they pick, or is it one doctor that's on call for that kind of thing?
So right now it's per doctor. So I have a code that I give my client, so she interacts with me, but Medici is in the development to be able to basically have an office where people can pick and choose. So then they can look at your practice and they can say, okay, he's on, she's off, I'm going to pick him. I know both the docs, but he's on call, so I'm going to turn him on. Good question. And
Based on the doctor choosing to turn it on.
Correct.
So they see if you're accepting or not.
Yep,
Okay.
and you'll see that when Dr. Pulim and I demo it, you'll be able to see the green light. But it's not here yet. Do you know your timeline on that one?
No, so the colleague function's available. It's just that on-off button's already there. So,
On-off button's there.
And the thing that I was talking about yesterday is bundling. So you can give a patient that code that Dr. Smiley has. You can actually add other practice members that you want available, so the patient doesn't have to find every one of them separately and connect to them. So
Good point.
When he puts that code in and the patients connect with him, it's up to him to decide who else do I want them to be able to access in my practice. So it's up to your practice management, how you guys have it, but we're flexible to go with any kind of flows that you have set up.
So I misspoke, it's already there. You would just have to educate your clients, or no, you could bundle it with one code.
That's right.
So you could say, okay, so what's your practice's name?
There's a veterinary hospital.
Okay, so you have that, so Medici creates a unique code, then all your doctors would be populated. When they put in that code, then they could pick from all the doctors.
And then you control when you're available and not available for them.
Each individual doctor controls that, so if they're willing to look, they can turn it on or off. Okay.
Correct.
Okay, your 6-doctor practice.
Okay?
Everybody's got a code,
Yep.
and it's Saturday night.
Okay.
Nobody wants to push the button.
Yep.
Do you make it so somebody has to be on call? So now you've got an ER around, and so one of the positives, we don't have to take call. We've got an emergency clinic. Are we now going to have somebody have to be at the button because clients now expect that?
So, are you the king? Do you get to determine what goes on in your practice?
I don't think those two are inclusive. Sometimes the king doesn't have much of a say.
So what I have found with the clients that I get onto this, the fact that they're spending money changes the mentality a little bit. So you don't have to be available, right? And they may come back and, hey, everybody have their green button on. And then you determine whether or not that's good customer care. So you as the boss might say, hey, everybody needs to have a green button on at some point. Or you go, hey guys, if you want to make some cash on the side, turn your button on whenever you want, don't. And then if the clients come back and brag like, hey, nobody had a green button on. Yep, we don't guarantee there's going to be a green button, but sometimes there is. So depending on what you want to do as far as for customer care.
The way that multi-practitioner practices handle it on the people side, you already have an established call schedule, so whoever knows, hey, it's your call time, they're the ones that stay on, everyone drops off. So it's up to your practice management how you guys do your call coverage. So it maps whoever is available for that block of time.
Well, I'm sure though, and there's a number of practices, mine, where we don't have call anymore.
Oh, sure. Yeah.
So I would
Because
turn your
of
green
the
buttons
ER.
off.
Yeah,
I turn them off. So then you say to the rest of the docs in your practice, like, hey guys, we have this so we can get paid for consults and we can put them in the medical records. At 7 o'clock, my advice to you would be turn that button off or you're going to get buzzed at midnight. And if you get buzzed, it's on you because you weren't responsible in turning your button off. That would be, if I was king, that's what I would say. Like, I don't want to, if you guys say, we don't ever want to go out and treat a colic at 2 a.m., turn your button off. And if your clients are already accustomed to that, don't say, hey, we're going to be available. The only reason I leave my button on is because I want my practice to grow. I'm in a fixer-upper, so I'm trying to fix it up.
So can you have a message that's visible to them directing them somewhere else? So for that situation, could you have, please contact the local emergency clinic at this phone number, so they don't feel like they're left hanging, they know what they can do, what their other action is?
Yeah, so, sorry, this is when you set up your profile, you
Yeah.
have a little place to add any messaging you want, so you can direct patients that way. You can have numbers you can contact. It depends on how you set up your practice flow, but you have the ability to, if they can't get in touch with you in your profile setting, you put in your education, and you have a section there that says, oh, here's some directions for how to handle if you can't get in touch. So you can put that in there.
Good.
Yeah.
Does it have the capability to have, for example, a different fee for a different time? Say like this much money in the early evening, and you want to talk to me at midnight, you're going to pay. I'm serious.
No, you're right.
Higher price deters nonsense. I used to do night call all the time. And I was a new grad. We got to keep the emergency fee. I thought, oh, damn, this is great.
Yeah.
And a year into it, I was like, I'll give you the money to leave me.
Yeah, so this all comes back to your practice management, right? So the best practice is to have these openly, transparently communicated, and you have the different fee schedules. So Medici is flexible. So Dr. Smiley was saying, $25 per consult. You could make that $50 after 11 p.m. and you just bill the patient twice. So it's 25 times. It's up to you. So you as long as the patient's aware and you communicate what the pricing is, that's the challenge that you have to overcome. Just so that they're not shocked. Like, hey, why am I? It's just how you handle that communicating that fee schedule to your patients.
I've never minded doing it, but I've really got under my skin at it. Just stupid nonsense in the middle of the night.
My experience is when people have to spend money, any amount of money cuts the nonsense.
Yeah.
And I mean, this is an exaggeration. I charge $25. I don't get nonsense because they're triaging it already. And if it's nonsense and I'm getting paid $50, I'll entertain your nonsense. Right? I don't care.
So you can have set up at different fees at different time periods.
Right, or like Dr. Pulim was saying, you can hit them twice. Like, hey, Mrs. Smith, so you can do whatever you want, and it's your responsibility for good customer care. So if you start gouging people, they're going to be like, well, he's shifty, I'm going to the other vet. That's capitalism, we live in a free market, right? So you do as well as you think you can. What Medici wants to do is give you that availability. Yeah?
Are you using it as, so say you really should come in for
Yep.
an appointment, like you're fine for tonight, would come in tomorrow morning. Are
Yep.
you using it as you charge $25 and they still pay the exam fee?
Yeah, good question. So case by case, typically what I'll do if it's after, this is me just specifically. So I had a dog that the owner was worried because the dog was in respiratory distress. So she did a Medici thing. I charged her $25. The dog looked stable. And I said, hey, you can go to the emergency clinic. Dog looks stable. And what I was guessing was the dog was in heart failure. Right? But I need to do a physical exam in the flesh. So I say, hey, the dog seems stable to me. If the dog worsens, you go right to the emergency clinic. I'll be by your house first. We do house calls. I'll be by your house at 8 a.m. She got a house call, exam, and a Medici. Now, if it's during the day and they're like, hey, they shoot me a video, I say, come on in. And then I don't push the button to get that to charge them.
During office hours.
Correct. So that would be totally up to you. And it's a little bit difficult for veterinarians because we wring our hands and somebody's going to get mad at us. So you have to decide what you're going to do. Okay? Let's do a demo, and that might motivate more questions.
Let me just switch this over.
What about doctors that can't even send text messages? You think I can train them to be on call on the smartphone app?
Adios, auf Wiedersehen.
Don't count on it.
Can't fire my dad, so.
Godspeed.
Okay, so here we go. Okay, so
Real quick, what you're seeing here is our live phone. So this is happening. So if we get a phone call or a text message from friends and family, please don't look at it. So this is my phone right here. So I'm going to be the patient, and let me make Dr. Smiley's phone bigger, and he'll be my veterinarian.
And this is all the cool stuff that Dr. Pulim has. And he started whipping out, I'm like, how are you doing this? He's like, whatever.
Okay, so-
Fantastic.
So just so you're clear, there's two sides to Medici. There's the professional side, which is the Dr. Veterinarian app, and then I'm going to be in the patient app, which is this right here. So what you missed here is that I actually invited to connect with Dr. Smiley yesterday, and he accepted me as a patient, or vice versa. Aaron, do you want to pull up your app and show them the code real quick? So if you go to
Oh, yeah.
settings. So and go to invite patients. Yeah. So we'll switch over there. So that's the unique code. So you can have that on your website, Facebook, Twitter, wherever you want. So your patients, when they connect to you, they know to put that in the app when they register, and that immediately connects you. Otherwise, I'm going to show you one thing here, which is you go to the Add Doctor setting here, and that's how I would find you as my doctor. So I know Dr. Summerray tried to do yesterday. I'm going to find someone. So you guys just throw out a name that's local here, and we'll show you how this works.
You want any kind of doctor?
Well, any one of your friends.
Did you add Kentrell?
Yes.
Matt Kentrell?
Yeah.
Did you add?
Oh, let me just search for Smith. Oh, yeah. So this is how easy it is. So if, for some chance, so what this is showing you is all the list of local doctors so that I can find you, right? So when I hit that invite button here, say Tyler Smith's my doctor. I go to invite, and it says, do you have this information? So if you're my doctor, I'd have your practice email or something, right? So I can hit yes. If I don't, so this is what's cool about Medici is that your patients find this on the iTunes Store or Google Play Store, and they're like, oh, I want to do this with my doctor. They can actually invite you without even knowing what Medici is. So that's when they hit no. I don't have your contact information, so it goes into our support team. They'll find your, office, whatever, call you up and say, hey, we have 10 patients that are trying to do you want to do this? And then it's up to you to accept or not. But it just gives the patients to allow them to do this with their doctor. So I already connected with Dr. Smiley here yesterday. So I don't know where he is, but I'm going to just send him a message saying,
Can you see my green light?
oh yeah, so let me go back. So that's a good point. So all of these indicators that say online, offline, so actually if you go to your settings, you can take yourself offline.
So I can go here and then I can go offline.
And see how it changed right here? So that's how instantaneous it is. So now I know if I send him a text, here, let me actually show you. That's a good point. Go back to offline. When I send him a text, that doesn't mean he doesn't get them. This text still go through, but I don't have to respond because patients know that, hey, he's offline. When he's ready, he'll get back to me. That's what that's there for. It doesn't mean you don't get the messages. It just means I'm not going to get back to you within my normal time I would get back to you. So that way you don't miss anything. So I'm going to click on your name.
Let me go back to this.
Typo. Okay. This is already in there.
Oh, yep, okay. So then I can see it from my side. Okay, so then I'd respond back and I'd say,
And the unique thing is here, when you get an alert when you're not in the app, it actually sends you, just like you get your text message alerts, but because we have to be privacy secured for HIPAA, it doesn't tell you what the message just says, hey, you have a Medici message available, and you get a little alert on your app, so when you log in, that's the only time you can read it. And the neat thing is, like Dr. Smiley said, it separates your professional conversations from your private conversations. So if you want to go back and try to find that conversation you had with that lady,
Yeah.
July 4th, like how are you going to get back to that, right? That's what's unique with this is I can go back anytime and see all the conversations I had with all of my professionals. So while I'm talking to Dr. Smiley here, after I'm done, I can go back and review all my previous conversations that I had.
like this is the dog with the bloody mouth that I was talking about. And you can even zoom in, right? There's a decent amount of blood.
So you can do pictures and video?
Yes.
Yeah.
And the
But
cool
not FaceTime?
Well, sure, yeah. So
FaceTime.
it's that thing that Dr. Smiley just showed you. The unique thing is all those images are segregated and secured within Medici, so they don't show up in your iTunes cloud or when you're showing family pictures. You don't get your pet pictures up there. So that's what everything is contained within this conversation.
Okay, so let me see.
there's a picture of the paw.
I mean, it's incredible. I like the cameras on your phone are just incredible.
And one of the unique things here is, Aaron, we can hop back out. So if you look here, this is the best part of Medici. The only thing the patients can do is message their doctor. But if you look at his app, you want to click on that camera?
Mm-hmm.
So this is when he can start a real-time video consult.
So you get out of your PJs probably.
So that's why we allow the doctor to control it, because he has to make sure, or she has to make sure that they're in a safe place where you're not going to violate any HIPAA privacy. So that's why patients can't just ping you. You have to make sure and kind of set the scene for them. Hey, I'm going to call you, make sure you're in a place you can talk to me.
And the client doesn't have access to your phone number?
Nope,
through
that's the
that?
best part. Yeah,
Yeah.
in none of this did he share his number with me.
Nope.
And the best, so after we're done here, I'm going to skip to the end, but
Yeah.
you want to bill me?
Yes, okay, so let me bill you.
So I'm gonna hit Okay, so I'm gonna hit
Hit
the
it 3
plus-
times.
I'm gonna hit the plus button, and then I'm gonna hit bill now. Oh,
And then, so on my end, see what happens here? Right here, he says, okay, I just got billed 25. And I don't have to do anything, because when I set up my profile, before I even start my first text, the patient app requires the patients to have in there, as soon as the bill happens, the patient doesn't have to do anything, it just bills their credit card. And on the people side, the unique thing here is you can actually have your FSA or high deductible health plan, your spending debit card, so you can actually draw down from that when you see your doctor visits to Medici. So if your pets have, I don't know if you have like pet insurance, I don't know how this works. So you may have some kind of dollars associated with your pet care, you can attach that here as well. Ultimately, one other thing here that's really cool is there's a button here that says enter promotions. So this is where you were talking about late night care. You could have promotions that are attached to different value amounts, right? So for your first late night care, you know what, call me at 2 o'clock in the morning, but I'm going to give you a code so that you can see what it's like and you can discount some of these. So you can set your price at $100 for everything, but if you want to try this out with me, put in your promo code and the first one's free. So you have options for how you want to use this with your patients.
Question?
Yeah.
Previously, you had said that the docs tried to set the fees kind of at what the copay would be. I took that to mean that insurance didn't cover any of that. Is that true?
Oh yeah, this is all
But
direct pay.
did you just kind of hint that in veterinary medicine, maybe if they have insurance
No.
on their dog, it would cover some of it, or
No,
no?
what I was saying is, on the human side, if you have a high deductible health plan, a lot of them have flexible spending account or HSA accounts that are a debit card attached to it that go towards your deductible. That's how the people are, like, if my mom or dad were sick, then they would have that if they were part of a high deductible health plan. So that whatever you're spending here goes towards your deductible before your insurance would kick in, or I would have to manually submit. So when the billing happens, later today, I'll actually get an email with the receipt, then I can send that over to my insurance company if I want to get reimbursed for it. But all of this is direct pay.
But it does,
Yeah.
you can use your HSA
Oh, yeah,
on the human
yes,
side
yes.
for that.
it would be interesting because if you just viewed it as an exam, I'll bet if people had pet insurance and then they get an invoice, because most of the stuff that I'm dealing with, right, they submit everything and then the insurance company just gives them money back. I'll bet you could put this as far as they could probably get reimbursed for. I would guess it's an exam.
Well, the cool thing about this is you got $25 and you didn't help him at all.
I know. Story of my life. Story of my life.
If you saw the first thing that showed up is this is a demo account, so no payment is
He bought me dinner last night.
You said that you didn't get his number. Well, you got his number to call him.
No, it was.
Did you just call Medici?
Yeah. When I go in here, these are all of my doctors that I have access to, and there's nowhere in here is the number. The reason I connected.
So the client went to Medici to get to him.
Correct.
Yeah.
Yeah. So I have, the patients have, the patients have, so instead of doing FaceTime or iMessenger or Facebook Messenger, Medici is just an app, but only to talk to your doctors and veterinarians.
Right.
Okay, gotcha.
So one last thing, if you go to your settings there,
Okay, so
Settings.
yeah, so if you go to history, as a doctor or veterinarian, so this history is all of the, can you scroll up? These are all of your consults that Dr. Smiley's done. And if you click on, you can click on my name.
Yep.
So-
Well, and I get, because Medici gave me a bunch of codes.
So when he does your, so click on my name again. So these are all the consults. So he doesn't have to wonder, like that lady in 4th of July, how am I gonna go see what happened to her? I can actually go pick up all my old consults and then see that link up there, it says export? That's how I get it into my EMR or my electronic patient record. So let me show you what that looks like. So this is my Practice Fusion account. On the people, I don't have your EMR access, sorry. So when I'm in the account, I can actually export that PDF link and add it right into my patient note, and I can have access to the entire transcript, so I can refer back to it later.
And this is how I do it. And Dr. Pulim showed me a better way as far as just to have it forwarded to the practice email. But right now what I do is I have it forwarded, so I'll show you, let me see if I have an old one. Well, this one should come through. So then I get an email, if it'll come through, from Medici that says, hey, a PDF is available.
Yeah, and that secure link is only active for 1 hour. If you don't download and delete it, then you can't access it later. So it's meant for making it so that you can add it to your EMR for a short window of time.
There it
if you
is.
need to request again, you got it done.
Okay, so here it is, ka-chunk, and then I can download it. So then I get, so now there's the PDF, and then what I do from here, but it's too many steps, then I export it into Slack, and then we put it into the medical record.
So depending on which EMR you have, so Practice Fusion and some of the ones that are on the people side make it easy to just add that PDF right from so that's the whole thing. So if you guys have any questions, happy to answer anything. Yep, go ahead.
For these fees that get collected, what's Medici's cut?
So there's 2 ways that we get paid. There's no upfront cost for the patient. The app is free to download, same for the doctors. So depending on how you want to set it up, you can either just do it as a fee for service. So for example, if you bill $40 for a consult, we take $8 of that. And then so there's no upfront cost to you. As you utilize it, when you get paid, we get paid. So ultimately you can try it out for no upfront cost for this. But that's how we get paid. And then ultimately you also have the opportunity. So if you already know you're going to have an established use case, so a lot of direct primary care doctors or doctors that are practicing in accountable care organizations on the human side, they already know that, hey, I'm getting prepaid money from patients. Medici would make it easier for me. So if I'm getting $80 per month per member to be part of my direct primary care practice, I don't need to start out. I already know patients are going to do this with me. So then you can just pay a fixed flat fee and keep 100% of your billing. So typically the pattern we see is, hey, I'm going to use Medici with my patients, try it out, a couple patients, and now we've seen between about 4 to 6 months is when you start seeing that switch over where patients like, oh yeah, I'm going to start paying. So you can start seeing the utilization ramp up, and then we get calls like this all the time. Look, so right before Christmas or right before New Year's, one of our doctors in San Antonio was like, hey, you guys took $200 this month. Like, yeah, but you billed $1,000 that you didn't have before. So then you're like, yeah, but so then they redo the calculation. So if I do $2,000 next month, are you going to take $400? Like, yeah, but you have the opportunity to switch over to a flat fee and keep 100%. So as this grows, you cap what our fees are, and then you continue to grow that practice.
What's the flat fee?
$149 a month. And so if you do 3 consults or 4 consults a month at $30-40, it pays for itself. Yeah.
How are veterinarians or you, Dr. Smiley, using it as I know there's no Indiana set rule on when we've seen the animal or the legality behind it. As that changes, will they update us as an app, or is that something that have you decided I have to have seen your animal in the past 6 months, or?
So usually, whatever the rules are, as far as in my brain, I say, when would I do a refill or something like that? And whatever your practice, because there's no defined rule in the state of Indiana. And then what I always do to be super safe is I ask the owner for a picture of the dog. Then I'm covering my bases. Because a lot of times I'm not sitting in front of my computer, so I say, hey, can you take a picture of Fluffy? Now I'm covering my bases. So then if the board comes to me and say, have you seen this dog? Yep, I saw it, right, electronically, and it's in my... So if the board says, for whatever reason, oh, you have to have seen that dog within the last 2 years, and it's been 2 years and 1 month, then I'm trying to be more conservative and go, well, I saw it on the screen as well. Now, right now, that's not a topic in Indiana. Nobody's getting brought up on, hey, you couldn't have a VCPR because it was 2 years and 1 day.
Anything else?
Yeah.
On that subject, I guess I don't know, I have lots of clients.
Uh-huh,
And just because they call me does not mean I will know if they were my client.
uh-huh.
Is there a way around, I mean, obviously they gotta get the code, so if they can't find the code, well, I guess you said they could search you too, so I guess I would struggle with that. First off, I'd feel really bad if I turned away somebody that was my client. I mean, 3.5 doctor practice, lots of clients, I may not know if they were my client or not for sure, so.
We actually have so if you start using Medici, we have a support team. The first thing we ask you for is, do you have a current patient list that you
Yep.
want us to communicate this to? So we help you, the first chance is to onboard all your current patients. So that's what Dr. Scott's been doing. And the way you incorporate into your practice also, and there's 2 layers to this. One is that the patients have to, you have to have that established relationship, but you also then have to accept the patient when they want to connect with you. So there's a process for streamlining. If you want to do it at scale, say you have like 2,000 patients, we help you onboard all of them, so it's all listed in there.
Okay, so do you guys want to go, and so the next thing we have is like a question and answer. Do you want to keep going question and answer now, or do you want to do a restroom break and come back and do question and answer? It doesn't make any difference to me.
Restroom break.
Okay, so let's stop, and then if you want to come